Shoulder anatomy is complex and subject to a variety of strains, sprains, muscle tears, and ligament damage. The most common reason for shoulder pain on either side is a problem caused by overuse of the shoulder, misuse of the shoulder, injury, or joint pain from a condition like arthritis. Shoulder pain from inflammatory conditions. Both left shoulder pain and right shoulder pain are most often the result of strains caused by overuse or misuse. Lifting heavy objects improperly or pushing or pulling something that is too heavy can damage muscles, ligaments, and tendons. This can cause inflammation in the strained or injured area, and as we all know, inflammation causes pain. Tendonitis is a common ailment that causes shoulder pain. When you have tendonitis, a tendon has become inflamed. This usually happens because of repetitive movement or overuse. Tendonitis is a common affliction of the shoulders, elbows, wrists, and other joints. Bursitis is another condition that causes shoulder pain on either the left or the right. Bursitis results from an inflammation of a bursa, which is a small fluid-filled sac that reduces friction in joints all over the body. As with tendonitis, it's most often caused by intense, repetitive overuse of a joint. Arthritis is a condition that generally doesn't affect most people until middle age or beyond. Overuse of a joint can wear down the cartilage, causing inflammation that characterizes arthritis pain. Arthritis, simply defined, means joint inflammation that causes pain, and it often limits the range of motion. Rotator cuff injuries. The rotator cuff is the part of the shoulder that stabilizes the back of the shoulder joint. Injury to this important part of the shoulder can be sudden, possibly from an accident or fall, or it can happen over time through repetitive, often strenuous motion. Rotator cuff injuries have ended the career of many professional baseball pitchers, but people in other professions, like house painting, are also prone to this condition. Rest, anti-inflammatory drugs like ibuprofen, and ice packs are the best treatment for rotator cuff injuries, but the most severe cases may require surgery. Shoulder pain caused by nerve damage. Shoulder pain can also come from a pinched nerve. Most people know what a pinched nerve is: the compression, constriction, or stretching of a nerve. The damage causes pain and a burning, tingling, or pins and needle sensation. It can also cause numbness. Diagnosis is best left to your doctor, because doing nothing can just cause more damage and deterioration. In some instances, there can be damage or injury to a nerve in the spine, which triggers shoulder pain along the nerve pathway. Once again, this can happen on either the left side or the right side. Frozen shoulder. About 1 person in 50 in the adult population will experience something called frozen shoulder during their lifetime. It can affect either the right or the left. The causes of frozen shoulder are not completely understood, but its effects are obvious: pain and loss of motion or stiffness in the shoulder. The process involves thickening and contraction of the capsule surrounding the shoulder joint. It's common for frozen shoulder to occur when a shoulder is immobilized for a period of time, particularly after an injury. Individuals with diabetes are also prone to suffer from frozen shoulder. Other risks include hypothyroidism, hyperthyroidism, Parkinson's disease, and cardiac disease or surgery. Shoulder injuries can often be prevented. Stretching exercises are important if you're going to compete in athletic events. Good judgment may be most important of all. Take breaks if you're performing a repetitive task with your arms, especially if it involves reaching up in some way. Preventing injuries that cause left shoulder pain is always better than trying to eliminate the pain after a problem occurs.